Good morning, and thank you for your patience. We were just getting set up with the technology this morning, and that's taken some time. This is our first virtual conference, so it's been a definite learning for us, and we're hopeful that that everything goes smoothly today for your experience. So as I said, my name's Corey McKenzie, and I'm a Regional Home and Community Care Coordinator with Indigenous Services Canada. I'm just going to provide some opening remarks and hand it around to our planning committee to get us started. So I'd like to first acknowledge that we're broadcasting from traditional unceded territory covered by the treaties of peace and friendship among Mi'kmaq, Maliseet, and Passamaquoddy peoples in the British Crown, and also respectfully acknowledge the territory of the Innu. So friends, welcome to our first, and hopefully not only, but first at least, Home and Community Care virtual conference. 2020 has been an interesting year for sure, a challenging year for many of us, and a year of uncertainty and often fear. And we'd like to acknowledge that. Also acknowledge that early on, communities took action very swiftly to protect their families and their communities, and so they have. There's not yet been an identified case of COVID within a First Nation community in Atlantic because of those swift and innovative actions. Health centers and teams implemented practical and innovative approaches, often far before provincial or federal guidelines were even in place. So I remember a conversation one time with Terry Knockwood, not sure if Terry's online, but if you are, hello Terry, and Nova Scotia government had just come out with the universal masking guidelines, and Terry pipes up, as she often does, and says, well, Corey, we've been doing that for weeks. And I said, oh, well, call me if you need anything, then I'll be here. So anyway, because of those swift actions and those approaches, people were protected and were safe in their homes. We heard stories about people using mobile technology to do home assessments, checking in on elders and seniors on a regular basis, dropping off food, just wonderful ways to keep people safe and in their home. So home for many of us, is the word alone brings the feeling of safety and comfort. And through the pandemic, though it's taught us much, it's kind of transformed our concept of home a little bit. Home is now seen as a place to work, learn, seek refuge, and for some, convalesce. Home and community care is essential and will continue to grow in its importance, and we appreciate and value the work that everyone does to support the program in an effort to keep clients and families together and in their home. So we hope you enjoy the next 2 days and the content that we've provided for you. It was based on some feedback that we got through surveys and through our home care meetings. I'd like to take this opportunity to introduce the planning committee, which includes myself, Pam, Elena, and Bev, who I've seen all log in, so that's great. We're all in different locations, but I'm going to hand it off for a couple of words from Pam. So. Good morning, everybody, and welcome.
Okay. Hi, everyone. Welcome. I hope you find. I'm sorry, I had to get my glasses. Should always have them with me at all times. I hope you will find this Home and Community Conference informative and relaxing. Please be patient with us. This is the first time we've ever done a virtual conference. Anyway, we're looking forward to the next 2 days. I hope you guys are too. Hope you enjoy. Elena, if you want to introduce yourself.
Hi, guys. I miss everybody. I wish we were doing face-to-face, and I miss our annual home care conferences that when we get together at night and have a adult beverage and get to chat and stuff like that. I am at the UMB Training Institute. And there will be students coming in soon, and they're going to be participating also. But yes, thank you for all the good job you've been doing, outstanding job. And I have been going to communities, so if you miss me that much, I can always come do a visit, of course, using PPE, but I do miss you guys. Have fun.
Thanks, Elena. Okay, Bev, would you like to introduce yourself?
Good morning, everyone, and greetings from Wagmacook First Nation. It's where I'm spending my time, and thank you to the staff, Jane and Leslie at Wagmacook, for hosting me today. Thank you.
Great. Thanks, Bev.
Sorry. Great, thank you. So thank you, wonderful ladies. You're a pleasure to work with, and it's been quite an experience. I know from viewing, it probably doesn't seem like a whole lot of work went into this conference, but I can tell you that this team has put in a lot of hours to organize these 2 days. So just to give you a little bit of the highlights from the home care perspective over the last year, we had our home and community care training survey that went out a number of months ago, and from that we're continuing to plan around opportunities for home and community care service providers and nurses and home support workers. So this virtual conference is a piece of that, but we are looking forward to the future and hope that things continue in a safe way, that we can, again, as Elena said, get back to face-to-face training opportunities, although virtual might be a component of the new norm. So some of those trainings we're looking at include Alzheimer's and dementia, palliative care, and a skills boot camp. So stay tuned for those. I'd like to just highlight the agenda for you so that you know what to expect for over the next 2 days. So we've provided the welcome and a little bit of the program updates. Going to hand it soon over to Lisa. We followed each module with a 15-minute stretch break so that people can grab coffee and do what you need to do to come back. And then each module is approximately 1 hour. We're hopeful everything goes smoothly. However, we have had, I'm watching my phone, but we have had an illness. Dr. Evans may not be able to make it this morning, so I just wanted to make that announcement. So I'll continue to monitor that, but I'll update you as the information comes to us. And then we'll finish up around noon today, if everything goes to plan. If you're joining from a health center, wonderful and welcome. And as you hopefully know, you're more than welcome to provide a lunch to your team and then have it reimbursed from the home care program. So I'm going to hand it over to Bev now to do the first introduction for Lisa. Thanks, everyone.
Good morning, everyone. Welcome to Lisa, who is from the Tobique First Nation, and you all have bios within your your mail-outs. So there's lots to read on Lisa, but to capture in a couple of sentences, as you know, Lisa's been around for a long time as a registered nurse for over 30 years. She holds a master's degree in nursing. Lisa has been one of the coordinators that led the launch of the home care program way back. In the early days of development. She also served as president of the Indigenous Nurses Association of Canada. Lisa is currently studying her language, and welcome to Lisa. Thanks for joining us, Lisa.
And Lisa Bawil, good morning. Sorry for being late. Miss Gay and Ellie Metzi, I'm sorry for being late. I thought I was coming on at 9:30, and then I didn't realize I didn't have the phone number. So I thought I had the number, but the number that I had wasn't working. So what I'm going to do this morning is I was asked to do an opening prayer, and this is something that's new for me because I am in my language program, learning Wolastoqey. Again, I was a person who grew up hearing the language but not speaking it. So this is really pushing me to become a speaker. So one of the things that I want to do is learn the prayers in our our prayers in our language. And so I want to share with you one of the prayers that I'm learning. And yeah, so I'll just start that now. I wanted to do a little bit of a smudge, but I think I will do that too as well. Let me see if I get my, sorry. Just have that going, because that was a little bit frazzling, that experience. Sometimes when you get frazzled like that a little bit, just sometimes a little bit of the smudge helps to calm things down and get you back in a good space. We all get frazzled a little bit, especially as caregivers. Okay, so Wuliwin Chupsidegeg, Wuliwin Chil Gizos, Ktlot Wenamagan, Spadel, Nagakuli Bazulgan, Wuliwin Chil Besezamak, Chil Alot Wesol Deeted, Wuliwin Chil Nibaused, Knibayot Wenamagan, Wuliwin Chil Gika Gano, Ktlot Wewagan, Pizon, Nagal Mijuwagan, Wuliwin Chil Ubziig, Geely Whipgig, Nagastokno, Wuliwin Chil Skeekwell, Geely Woolly Mahaskil, Wuliwin Chil Weasizik, Baki Dunia Negmau Cheek, Wuliwin Chil Namasik, Baki Dunia Negmau Samagwan, Wuliwin Chil Zipsizik, Wulat Wenmagan, Wuliwin Chil Wujausen, Wulam Gizi, Wuladamuk Deben, Wuliwin Skitgamig, Chuk Sidegeg, Eli Wulayawinuk, Wuliwin Chil Samagwan, Madach Wen Gidwismil, middle age. And I'll also tell you what that means in our language, in English. Thank you for the sun. It gives us light and keeps us warm. Thank you, stars, for your twinkling. Thank you for the moon. It gives us light at night. Thank you for the plants that gives us medicine and food. Thank you for the trees, especially the ash trees and the fir trees. Thanks for the grass, especially the sweet grass. Thank you for the animals. They keep the forest clean. Thank you for the fish. They keep the waters clean. Thank you for the birds and their beautiful songs. Thank you for the wind. It makes us breathe clean air. Thank you for the earth, for the good things you have given and done for us. Thank you for the water, so no one will go thirsty. So be it. So that prayer is one of my major goals, is to really let that prayer sink into my soul and to be able to kind of just breathe that prayer every day, because gratitude is one of our biggest strengths as a people. I think that's really, how we've learned to live with our environment so well, is because of the gratitude that we have for all of life and the respect that we have for all of life. And to me, that's where we should, puts us in a good mind frame every day when we show gratitude for the things that we have. And I know sometimes it's hard to do that, especially, when we have busy schedules and we're busy doing the things that we're all doing to care for people and to, do good for our communities. So I feel so humbled and honored to be able to ask to come and speak with you frontline workers in the First Nations and Inuit Home and Community Care Program. I've come a few times, and I think the times that I've come has been in person. I don't know, some of you might have been part of the program for some time, but when the program first launched, geez, I think it was in I don't want to get this wrong, but anyway, yeah, it's been a lot of years when the program first launched. I've been a nurse for over 30 years, so I know it's probably been about maybe 20 years. Is it 20 or 25 years? Anyway, when I was in home care and when this program was being launched, and it was such a great, in all of my nursing career, I never imagined that such a program would exist. Because when I was nursing in communities, I was the only nurse. I was their home care nurse. I was their community health nurse. I was the everything nurse. So it's so good to see so many of you sitting there and working in your communities. You're giving so much to your people, especially during this difficult time of COVID, and this is a real challenge for us as healthcare providers to reassure people, to help people with their fears and their anxieties at this time, because when people are at their most vulnerable state, it is then when they really need the most support. So, the thing that I really, when I was working in communities long time ago, and it probably hasn't changed too much since then, is that one of the things I loved was going into the homes and visiting with the elders. That was my favorite thing to do, even though I worked in the clinic and did immunizations with the children and did blood pressure clinics and did all of that. My favorite thing was to go and sit with the elders and talk with them and then try to lift their spirits somehow. And I'm sure that's what most of you do. You try to, go in there and do whatever it is that you need to do, but you also try to lift their spirits, because we don't really realize, and I guess because I've maintained a lot of relationships with the people that I used to service when I was a nurse, I've gotten to hear back from them how much it meant to them for me to come in and spend the time that I did with them, especially when times were tough and rough, and just somebody to come and listen and to be there and to reassure them. And that really, really helped a lot of people get through some tough times. So, the thing that I remember a lot of is there's a lot of fear out there, especially, again, like I said, during these times when you have a pandemic going on. I mean, this is probably, there's not too many pandemics that we've had to go through as a society, but this is something new for a lot of us, and so it's easy to get caught up in the realm of fear, and but the only thing that really, really combats fear is to love more. If we know how to love and give kindness to others, then that really dissipates fear. So when you go into the homes, I think that even if you don't say it to people, but you just send them some love and just give them kindness and show them that, there's really nothing to be afraid of. I mean, yes, we might get COVID, we might get very ill from it, but, the chances of us will get well. And that's the thing. I mean, we can't give false reassurance either, but we just need to kind of all do our best and know that we can fight this, and I really do believe we can, and we will. I'll just hold on a second. The button thing that keeps coming up, whether I should trust this this format or not. So the other thing that I really I wanted to share with you today was that, other than the fact that, I really want to encourage you to spend more time with it. I know it's hard during these times of COVID, precautions and all, but even if it's a phone call, even if it's something, especially people who are shut in, it's a really tough time for people, because we all crave human interaction at some level. Some need more than others, but we all do need that. That's one of our basic needs. So take the time to even just call and say, hi, how you doing? Was thinking about you, type of thing. And that's something that I found went a long way, even when I was working in the community. That being present for that little moment, like with a person is really giving them your full attention at that moment, instead of trying to do multitasks like a lot of us are kind of trained to do and be. Just giving a person your full undivided attention for a short period of time can, give them lots of reassurance that you do care, and that, trust is developed by that action as well, so that you feel that you have developed a trusting relationship with that person, because they trust you when you show them that you care. So the thing with that too is, like, the longevity of being in the health profession for me has always been, for myself, is to stay balanced. It's important for me to be well within myself, because if I'm not well within, I can't give to others. I can't give my very best to others. And I think, to me, that's one of the hardest things to do, is to stay balanced, because it's not something that's static. It's something you're always kind of striving for in your life. And balance comes through, taking care of your physical body as well as your spiritual body, your emotional body, and as well as your psychological aspects of yourself. So just kind of keeping all of that in balance it's a full-time job. Like it really is. And to me, it's like, how do I keep well so that I can be well for others as well? That to me is my life mission, and it's not easy. And it requires you to get a good night's sleep, have good nutrition, exercise, walk, and daily, like things that I do is I try to walk every day. It just gets me out. It gets me breathing good fresh air and keeps me in a good place. And do things that bring you joy. What brings you joy? Like, to me, I like to listen to music, and that to me brings me a lot of joy. And just being around young people, older people. I just love being around and staying connected to the ones that mean the most to me. And and finding time to laugh. And even if it's little things that you've done in your day, take the time to laugh, and sometimes and share those funny moments with other people, get them laughing. Those are the things, the simple things in life that really, really count, and have kind of helped to maintain my well-being over the years. And the one thing, I guess, that, I don't want to take this on too long because I've been late coming on, and I know you got a full day of excellent talkers. I mean, Dr. Evan Adams, I was so excited to see that on your agenda. It's awesome. I grew up watching the movie that he was in, Smoke Signals. And, speaking of laughter, that's, to me, is, things like, if it's watching a show that makes you laugh. There's so much intense TV these days. Like, I can't watch this intense TV, especially during, when we were in lockdown. And I thought, I got to find more uplifting things to so that my spirit doesn't get so dragged down by all this stuff. So it's doing little things like that to bring yourself joy so that you can give joy to others. Because if you're stressed out and you've got too much on your plate, then it's hard for you to be effective to other people. And I can't say that enough because it's very true, and I've learned that over my years. The one thing that's for certain for all of us is that there is change is inevitable. We all must learn to adapt to the changes that we're faced with every day. And when we're in a good balance, in a good place, then when changes come, we're more able to deal with them and address them and be able to adapt. And it's important for us to realize, like, what are the things that we can control and what are the things that we can't control in our lives. And some of the stuff that's happening out there, we can't control that. But the things that we can control are our thoughts, our behaviors, and our ability to love and to be loved. And to me, that is the essence of life. And I know you're all doing your very best out there to be the best you can all be each and every day. But I challenge you to try even a little harder, because, that's what I try to do for myself each day, is when somebody's really getting on my nerves, or when, something, I try a little bit harder to love and to be kind, even when I don't feel like it sometimes. And it's just pushing yourself, making those changes that you need to make. So that's about all I have to say. And I could ask for any questions if there are any. I'd like to say thanks to the organizers for asking me to do this, as well as, to the people who have kind of lifted me up over the years. And I was talking about loneliness somebody had asked me, what's your definition of loneliness? And I thought, geez, that's a weird concept. That's actually a weird concept, because I've never, and maybe I don't think I've ever felt alone or lonely. And because they were saying how a lot of people are feeling very lonely during these difficult times, where they're having to isolate and all that stuff. And I was like, well, I said, to me, it's like, if you understand that you're a spirit, and that your spirit comes from, a greater spirit. You're part of a community already, that spiritual community, right? So you're never really alone. Those ancestors are there to guide you. Your ancestors are there to guide you. Whether you're native or non-native, they're there. You just have to be open for that concept. I mean, if you think that you're, I guess it depends on how you look at things too. But to me, I've always looked at it like, I'm being guided by the spirit world as well, and I take my directions from there. So to me, that is where I sit on this whole concept of loneliness. So, to me, it's like I enjoy every day, and I'm grateful for each day. And I think that's, if we can all like try to kind of embrace that the gratitude, and just be grateful for the things that we do have and the abilities that we do have, and realizing that change is inevitable, and we all have to adapt and figure out new ways to adapt. I mean, I just look at this whole program in and of itself, and the people and the changes that have been in this home care program. Awesome. So I wish you all the best during these difficult times, and please find time for your own. And if you don't know what brings you joy, then think about that. Maybe that's something you need to think about. What gives you joy, and try to carve out things in your life that bring you joy, and allow them to come in. And it's not a selfish thing, but you're doing it for yourself, but you're also doing it for others, because when you're a joyful person, or when you're what they call a happy person, then you can also pass that on to other people. So that's what I have to say for today. And again, sorry for being late, but technical difficulties. This is our new reality, I guess, and we just have to accept it. Are there any questions, or is there anything anybody wants to share or say? Dama? Anyway, I'll pass the feather on to whoever I need to pass the feather on to. Who's ever up next. Good luck with your day, and I wish you all the best.
Thanks, Lisa.
Yep, you're welcome.
Yeah, believing.
Thank you so much, Lisa. On behalf of the Planning Committee and all the community nurses that are, and CCAs and PSWs that had the chance to listen to you today, thank you. We're going to take a break until 10:15, so I hope everybody brought a snack and some coffee, and we'll join you back in 15 minutes.
Okay, so we're going to move on to the next presenter. Elena, do you want to introduce?
Yes, I will. Here from
Thanks.
UMBI Training Institute. I would like to introduce Stacey Maguire. She's a proud Mi'kmaq woman from the Glooscap First Nation near Hartport, Nova Scotia. She comes from a strong line of Mi'kmaq women leaders and basket makers, and is pleased to see that the trend is continuing with her daughter, Skylar. Way to go, Skylar. Her bio is in the agenda. I won't do it all because she has a lot to brag about, so I'm just going to do some highlights. Stacey graduated from Acadia University with a Bachelor of Business Administration. She holds a Certificate of Occupational Health and Safety from UMB, and is the first Mi'kmaq to be the nationally certified as a Canadian Registered Safety Technician. Way to go. And Stacey was featured in June-July issue of the Canadian Occupational Safety magazine. Now I want to go out and read it. And she received the 2018 Outstanding Service to the Canadian Society of Safety Engineers for the Atlantic Region Award. And Stacey's goal is to build strong safety culture within her own community while assisting other First Nations and non-First Nation partners with their safety initiatives. Welcome, Stacey Maguire, and you're on.
Hi, everybody. Thank you for the introduction and the invitation to join this conference. Again, my name is Stacey Maguire, and I'm the Senior Health and Safety Manager at Glooscap Ventures, which is part of Glooscap First Nation. So I'm going to have the help desk work my slides, so hopefully that will go okay. As Corey mentioned in the opening remarks this morning, the pandemic certainly has changed a lot of things and in our lives, and the use of technology is definitely one of them. So as many of you, I am now proficient in Zoom, and was very proud of that. And then Monday, they told me we're not using Zoom. So I was a bit panicked. But like Lisa mentioned too, this, through the pandemic, we've learned to adjust and to roll with things and to be adaptable. So I am now learning Polycom presentations. So hopefully it will go well. And it's my first virtual conference, so thanks again for the invitation. I'm going to talk today about our Workplace Health and Safety Committee and here in Glooscap, and this could also be called Occupational Health and Safety Committee or a Joint Occupational Health and Safety Committee. These are all really the same thing. And our health and safety committee really took a community approach, and that's what I wanted to talk to you about today. So I can't see my slides. I don't know if you guys can see them or not. Okay. 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 Next slide. Oh, look at that. And it worked. Yay. Okay. So I really like this image. Teamwork makes the dream work. And that's really what our committee is about here in Glooscap. We work together to find solutions to the health and safety concerns in the workplaces from a variety of perspectives. And as a team, we come together from different workplaces with different roles, different jobs, different perspectives. We think about things in different ways. So it is really a great way to come up with different solutions that, you know, I may not think of or somebody else may not think of. But when we get together, you know, 10 heads are better than one kind of thing. So we looked at Glooscap First Nation as a whole. All the workplaces were important. So we didn't just have a committee at the band office because there was 20 plus people there, and that's what the regulations say. You should have a committee when there's over 20 people. We have a committee that's made up of all the workplaces in Glooscap, no matter how many people are at each of the workplaces. We have many different ones with small numbers, so we just decided to treat it as a whole. And we all have the same goal of, in each of our workplaces, to have a healthy and safe place to work. So we're essentially all paddling in the same direction. So that's another reason why I like this image. We're all moving towards the same goal of having those safe and healthy workplaces. Next slide, please. So our committee, we started in the beginning of 2019. And as I mentioned, it's an approach. So we have representatives from to the workplaces. And those are all my little acronyms to remember them all. So we have the band administration building. We have the health center, the community center, Glooscap Ventures, which is our economic development office, which is where I'm located. Glooscap Corner, and I have a ×3 there because we have a representative from the gas and convenience side. We also have somebody from our Greco Express, and then somebody from our gaming facility. And then the last one is Glooscap Sweetgrass Convenience, which is our highway location off of Exit 8A here in the Annapolis Valley off the 101. And that is another gas and convenience store on our highway development, which is about 5 kilometers from our main community. We have a great mix of people on our committee. So we have employees and management, and we also have a counselor as well. So that, again, different perspectives from the different levels as well as jobs and responsibilities. We meet regularly. We have received training. So the Health and Safety Committee members all received training on their roles, responsibilities, everything to do with committee. We also at that time developed terms of reference, which is kind of like the rule book to a board game. So your neighbors are telling you all about this new board game. You go out and get this new board game. You kind of get the gist of what to do, how to play it. You probably can play it without the rule book, no problem. But the rule book really does help. It tells you what to do in certain circumstances, how to go about things. And in our terms of reference, our rule book, it says who's involved, what workplaces, how long they're going to be on the committee, how often we're going to meet, stuff about minutes, who's going to take the minutes, how they're going to be distributed, and the roles and responsibilities. So it's a great document to have, as well as people change jobs, change positions. So it just allows the committee to keep moving along if some of the players of the game change, I guess. The next slide, please. So this one is just about connections. I was looking for an image to show our connections, and that's what First Nations communities are all about, connections. I mean, I should introduce myself as I am the granddaughter of the late Chief Rita Smith here in Glooscap First Nation. My mother is Della Maguire, as you know, so some people will know my grandmother, some people will know my mother, probably more than they know me, but that's what it's all about. People always say, who's your mother? Who's your grandmother? Who's your father? That it's just about those connections. And when I'm across Canada and I meet Indigenous people, they always ask, what community are you from? And then they start with the stories. Oh, I was to that community before, or I was to this community, or since we're here on the East Coast, or oh yes, a few years ago I went to the East Coast and I visited this community or that community, and it just brings us together, and those connections help us form relationships. So when we think about health and safety, those connections are really how we look at things of how it's going to impact the communities. Our family, our friends, our neighbors, those are the ones who are working at the businesses, at our offices. They're the clients that come into the offices. They come in and purchase our gas, and they send the kids to Head Start programs. They attend different programs we have in the community and the events. So it's all really about those connections and keeping healthy and safe workplaces for everybody. So next slide, please. So some of the things a health and safety committee does, we respond to health and safety concerns. So we would recommend solutions, try to, again, teamwork, put our heads together, come up with some different solutions that may work in the workplace, participate in the implementation and monitoring of a health and safety program, conduct workplace inspections. So inspections are just a way to regularly look at your workplace, how things are going, look for hazards. Are walkways clear? Do they have a lot of trip hazards? If there was an emergency, can we all get out of the building safely?
Oh, okay, we're doing.
Sorry. And are the emergency exits blocked? In the winter, are the walkways getting cleared so everybody can get in and out of the building safely? So it's just a checkup on the workplace to make sure that we are doing everything we can to make sure everybody is safe. Are there new equipment? Are there new concerns? Things like ladders. Do we use ladders? Are they still in good shape? Should we still be using them? Do they need to be repaired? So the inspections are ways to kind of look at those things to keep us safe. If there was an incident, the Health and Safety Committee can help to look at those incidents, understand why they happened. We really want to just get to the root causes to try to prevent these things from happening in the future, and then we can share them to our other workplaces. So, we have the number of workplaces that are involved with the committee. So, for example, if somebody slipped and fell in an entryway, why did that happen? Well, possibly it happened because the seasons are changing. We had a first snowfall, and the snow melted, and somebody slipped on the water on the floor. Well, that just reminds us, okay, like we need to. Maybe it was an early snow and we hadn't got the mats changed or the new mats put in. Well, it reminds us to do those things, and maybe we need to look at different kinds of mats in the entryways, and we share that information with the other workplaces so that it reminds them, and it maybe help prevent an incident in their workplace as well. The Health and Safety Committee also can help with resolving workplace issues, maybe a work refusal, and they again can come up with solutions to the hazard or to whatever is going on why the work refusal has happened. Next slide, please. So some of the projects. So here in Glooscap, we are working on our health and safety program for each of our workplaces, and they are all, they're all separate, but they're all linked together in one system as our band administrator reports to Labor Canada about that. We have health and safety boards in each of the workplaces, and that's a great place that staff can quickly go to find emergency contact information, who has first aid, their first aid certificates, information like that. We did a look at all of the first aid kits and AED machines in all of the workplaces. Whether did we have them? To first off, what was in them? Did they need new supplies? Was the AED machine working? Who's been trained on it? All of those things, and it just gave us really a look at, again, our community as a whole, the community approach at where these are located, where they are accessible for people, and make sure that the batteries are working and that they have all the supplies that we need. Signage for the playground was an interesting one. We had a new playground installed recently, and when they were thinking about the signage, we wanted to, they asked us to consider what we would want to put on for safety messaging. So we had made some suggestions, and also how the community can report hazards. So again, the community approach, where this is a workplace of a recreation and the maintenance staff, and we want to make sure that they're safe while they're there if they have to maintain it, but also the community members. They can report a hazard to the band office of things that they see there. Is something broken? Do we have broken garbage? Is there needles? Things like that we want to make sure that we know about, and then we can find ways to come up with solutions. The other things, lighting, ice on the roofs, crosswalks, these are types of things that we do look at from a concern for the workplace, but we also look at how it affects the community as well. And the lighting is a good example. That was an issue that was behind our community store, and the issue was that there wasn't enough lighting, so that when the staff were taking out the garbage to the dumpster after dark, after the shift ended, then it wasn't safe for them. They didn't have good lighting to make sure they didn't trip over things and that kind of thing. But when we really looked into it, behind our store is a driveway, and because there wasn't good lighting there, things were happening back there that shouldn't be happening. Deals were being made, whatever, those things that happen in places that don't have good lighting. So that was a concern on a community level. And again, we looked at that as this is going to help the employees because they're not going to fall. They're going to be able to have good lighting and see where they're going. And also it's going to help the community because maybe those people who are lurking in the dark, I don't know what to say, are not going to go there anymore. And that just takes away one more spot that these people can meet up and make transactions or whatever they happen to be doing. So that was something that was brought up through the Health and Safety Committee as a concern, and we looked at it in more ways than just the employee. So next slide, please. So this is mostly everybody knows that working in the First Nation community, this is a braid of sweetgrass. Our traditional medicine represents the hair of Mother Earth. And so I really like this as kind of a summary and closing for our community approach to health and safety, because the strength of a braid really comes from the pieces working together, as opposed to each strand on its own. And it really does represent our committee and how we do work together. All of our workplaces work together. We think about the community, so that our goal of healthy and safe workplaces can be realized. So next slide. So that's it for me. I hope I didn't talk like a mile a minute, because I feel like I talked a mile a minute. So I apologize if I did. Walalio, everybody, thank you so much for listening. Again, my first real virtual conference, so I hope I did okay. My information is there if anybody wants to email me, and I have no idea what the time is, 10:39. So I guess we can do some questions or chat or whatever you guys like to do. So thanks.
A few minutes. If you're joining from your personal computer or laptop or iPhone, you can either use the chat function, or if you're joining from a health center, you're more than welcome to speak up now to ask Stacey any questions you might have if you're forming a committee, or if you have occupational health and safety concerns that come up in the world of home and community care, as they often do. She's here as a resource for you now to ask any questions. If something we can't answer today, we'll certainly take that offline and get the answers that you need. But do we have any questions?
Hi, Corey. It's Elena. I do have a question for her. Thanks, Stacey. Where we are in a global pandemic, is there something specific you look for at the health centers?
You mean as far as prevent COVID-19 prevention? Is that what you mean?
No, I'm thinking thermometers, sign in and sign out sheets, sanitizers.
Oh, yes. So each workplace should have COVID-19 protocols. Here in Glooscap, most of our buildings, the office buildings, are closed to the public unless it's by appointment only. We do have protocols on wearing masks, sanitizing your hands. I know in our office we have an information sheet, a questionnaire really, that we have people fill out when they do come. We do pre-screening questions before they arrive, and then when they do arrive, they do need to fill out a questionnaire so that we can have that information, that contact tracing, in case there is a case that comes up. And we're responsible in our office. We're responsible for whomever we bring into our office. So if I have somebody come in to meet with me, I'm responsible for them, and I would sanitize all the areas where they, like the boardroom or the office where they have been. So does that answer your question?
Yes, it does. And the only reason I was thinking like that was because even if you go out to eat now, like at a restaurant, I know they'll ask for your contact information and stuff.
Yes, absolutely. So, and the reason for that, if there was a case or an outbreak, they do want to make sure that they can contact as many people as possible that have been in that area, so that they can be tested as well. They can isolate. They can have that information. So all of our workplaces, there was a time where all of our workplaces were closed and everybody worked at home. And as time went on, we had these protocols come into place, and more people were started coming back into the office. Now, we do still have people that are working at home or kind of half at home, half in the office. It just depends on your job and what your role is. But for sure, every workplace that we have here has COVID-19 protocols as part of the health and safety program.
Thanks, Stacey. I have a question from the chat room, and it's asking if you wouldn't mind expanding on your committee membership. Are they all from the community, all committee members?
They are all. I'm not sure if you mean if they're all community members and band members. They're all employees of Glooscap First Nation. I guess I'll put it that way. So we have mentioned we have representatives from the health center, band office, community center, all of the different workplaces, our retail locations. Chief and council has a position there. They're our director of administration. So all of the members are employees. We have thought about opening it up to the community at some time if we wanted to have community members join us. We're working at developing our health and safety program right now, so we're concentrating on that, but we have thought about adding community members to our committee as well in the future.
Thanks, Stacey. Another question that's come up quite often is around federal and provincial jurisdiction and how to navigate that and what falls within what and if it even matters. Have you had any experience with that with your committee?
Yes, certainly have. So I like the, you know how you go on Facebook and you can change your relationship status and my favorite one is it's complicated. Well, that's what the jurisdiction issue in First Nations for health and safety is. It's complicated. I've talked to both federal and provincial health and safety officers, and they're no more clear than we are. I mean, we're the ones asking them questions, and they're still not clear about it. It's not as simple as, do you work for a federal employee or a provincial employee? Do you work on federal land and provincial land? It has a lot to do with the activity of the workplace. For example, our gaming center here, gaming is provincially regulated. So that activity could be looked at as a provincial activity, as a provincial workplace. But it's here on our community. It's on our federal land. So the other part that comes into it is, how does it benefit? Does it benefit the community? So things like, if we were to put on a cultural activity, or if that was your role of the workplace, is to put on cultural activities for the community, providing those services, the health center providing health services to the community, that would be seen as a federal workplace. So our monies, our revenues from the gaming center all go back into providing programs and services for the community. So my argument is, is it federal? Is it provincial? And it really comes down to, there's no clean answer. There's no, it's not black and white, but really for us in Glooscap, we say we don't care. It doesn't matter to us because the regulations are only minimum standards, and we never really want to work to the minimum standards. So what we've done here, as we're building our program, we look at both provincial and federal, and we just to make sure that we're above. We're doing more here than the minimum, because we want to make sure that everybody is safe, and we create what works for us, and it's higher than both the sets of regulations. So, and if there is an incident, we just let them figure it out. We can call either, some incidents need to be reported. So we can call Labor Canada, we can call the provincial OHS line and let them figure it out. They're gonna come in and say, yes, it's us, no, it's them, whatever. Let them kind of fight about it. We're doing our own thing, and maybe someday we won't, as self-governance and all that stuff comes in, we won't really need to worry about that. So we're just doing our best and doing more than what they needed anyway. So hope that wasn't too of a convoluted answer.
No, it's as you say, it's probably a bridging of kind of both legislations and understanding it as a whole, really, kind of to organize your occupational health and safety activities. One question that does come up, and I'll open it back up to the floor, but the workplace for home and community care providers is often a person's home. So I'm just wondering if that's come through your committee to help kind of navigate some of those questions that may come up around the staff or employee not feeling safe in an individual's home or having concerns about, I don't know, the doorstep or things like that. Is that a place for the committee to help support staff with those situations?
It certainly is part of the whole process. In the health and safety world, they really talk about the internal responsibility system. So when I first started in health and safety, they started talking about the IRS, and I thought it was the tax people, but no, it's internal responsibility system. And what that means is everybody works together at whatever level they are to keep themselves and their whoever they work with safe. So in an instance where somebody doesn't feel safe because of something in their work day, they're going to, like you say, they're going to a home and the steps aren't cleared, or there's a big dog, or whatever reason, whatever hazards come up that they don't feel safe, that's a conversation that should be had with their supervisor, and together they need to find solutions to those things, and there's hundreds of solutions to each problem. It just depends on your perspective, on your community, but definitely if that solution can't be found, or they need more suggestions for solutions, that's when the health and safety committee can really come into play, because that's kind of like your next level. And here in Glooscap, we've developed a health and safety concern form. So we want to make sure it's documented. Documentation is huge, and they say if it's not documented, it never happens. So if you have a concern here in Glooscap and for our workplace, we've also developed one for the community as well. So whether you're a community member or an employee, if you have a health and safety concern, we have a form to fill out. It goes through your supervisor first. If a solution can't be found, then the next level is to involve the workplace health and safety committee. If a solution can't be found at that level, or if a solution can't be implemented. So when I talked about the ice on the roofs, well, that's a big, what needed to happen was we needed to have some devices, or I don't remember what it's exactly called, for the roofs, so that I don't know, they're ice guards or whatever they're called. I can't remember, sorry. But that was a big expense. So that solution couldn't be implemented at the supervisor level or at the health and safety committee level. That actually went to chief and council. So that's our next level. So we have a system in place here that we go through each level to find solutions and implement them. So the health and safety committee is kind of the middle step there, that if you can't find solutions within your workplace, then they are able to help you find other solutions or research or investigate for you.
Stacey, this is Christiane in Natwashish, and hi there. I am interested in your form sheet, the one you just mentioned about health and safety. I have one, but I wonder whether yours is better. So I can certainly email you and ask you to send me a copy. But I'm just tossing it out in case of other people wanting to see it too, and then you could send it to Corey and he can distribute it.
Sure. That is great. You know, that's the whole teamwork, right? Teamwork makes the dream work, and we are a team within our community, but we are a team within the bigger community. So anytime if I can help you guys out, just please ask me, send me an email.
Thanks, Stacey. Are there any other questions from none from the chat room? So any other questions from the health center? So it also occurred to me, Stacey, and don't mean to put you on the spot, but even maybe sharing the terms of reference, if you'd be open to that, might, if there's some teams that are looking at starting a committee or looking at that, maybe if you'd be willing to share that, perhaps. You don't have to answer that now, but okay.
Yeah, absolutely.
Awesome.
Was somebody shared with us, and we'd be happy to pass that along to anybody.
Okay.
So I do have one more thing I'd like to mention, if that's okay.
Mm-hmm.
I talked to and Corey, you actually connected me with Heather Matthews of the Nova Scotia Health and Community Services Safety Association, and I think some of you may already know her, and she's given you guys some presentations before. But I really wanted, for anybody who doesn't know of this, their website is awarens.ca, and they have a lot of online learning classes and events and programs, and it's all free. So this is a great resource for, I just have a list here, a few things that they offer: Code White, donning and doffing PPE, the internal responsibility system, lockout, tagout, transportation of dangerous goods, WMIS, safe handling and mobility. Those are just a few of the things that you can learn about on their website. Like I say, some of it is online learning, but you can connect with them. I have a meeting with Heather and our director of the health center, Charlotte Warrington, in a couple weeks, and we're going to see how those services can help with our needs here in Glooscap. So it's always good. Again, the connections, keep those connections going, share those connections, share the resources, and we can all move forward for healthier and safer workplaces.
And I can share that link too after the conference, Stacey. They are kind of specific to home and community care, which is great. The information that they have, although they are a Nova Scotia association, is very generalizable. So if like the donning and doffing, for example, and all that stuff, so I can definitely share that information too. So.
And they may have other links. Heather may have links to the safety associations in the other provinces as well. So that might be a good resource to start there too.
So last chance for any questions from the floor.
I have one right here, Corey.
Hi.
Hi, this is Trudy.
Hey, Trudy.
This is from Escazoni Home Care.
Yeah.
I have in the light of Joyce Ekequan from Quebec. She died in a hospital, and I'm just wondering what kind of services are available for cultural awareness, like courses or anything like that for new employees or staff coming in to First Nations, what kind of things are available, or what's Health Canada doing about that kind of stuff?
Well, in terms of occupational health and safety, do you mean, Trudy? Yeah. I think, I mean, this is sort of we invited Stacey here as a sort of conversation starter because I think one thing that the pandemic has shown is how perhaps unprepared organizations were in terms of occupational health and safety, and really highlighted all those gaps, unfortunately. I think I can't speak specifically to what Health Canada is doing right now. I can certainly follow up with that, but I think what we are interested in is supporting occupational health and safety initiatives and making linkages such as the ones that we've made today with Stacey. It's like I say, I think it's an overlooked area of the work that we do, and it's often under-supported. I'll just say that, and I think we recognize the gaps, but that's not a great answer for you, Trudy, to say that we are making active steps towards filling some of the gaps for occupational health and safety. I know traditionally it's been looked at as a very much an employer responsibility. However, my argument for that is, well, if employers are already underfunded and most of the program dollars go to the client care, then what's left for occupational health and safety? So I think it's definitely an area for improvement. But so again, I apologize for not a great answer, but Stacey, if there's anything that you would like to offer for information, certainly like to hear your perspective.
It's a tricky one. Again, I know that we put on here in Glooscap for the Nova Scotia occupational health and safety officers, the provincial ones. They wanted to have a cultural awareness day, and one of our former employees, actually he's not with us now, but we did make that happen for them. So there is that the desire for that information. The problem is there's not a whole lot of organized information out there, places that you can go. It's more finding little pieces here and there. I know the as a whole for the country, really, the University of Alberta has an online course called Indigenous Canada, and it's a 12-week course, and it does go into talking about history and treaties and residential schools and all that stuff. And for me, I think that's the knowledge and the awareness of everything historical needs to happen. I don't know exactly how that. I would love to have one place that says, "Yep, this is it. This is the course that people need to take." I guess I don't have a real good answer either. There's bits and pieces out there. I know the mental health first aid for First Nations. I'm sure a lot of people have taken that. That is an awesome course. But it is about that awareness and what we can do, even in our own workplaces, and those stories that we are hearing. They're heartbreaking because people just don't have that knowledge and have that understanding. I mean, we see it in healthcare. We're seeing it a lot in fisheries right now. We're seeing it in a lot of places. So there is, unfortunately, there is much work to be done. So,
yeah, I don't know if you mentioned, Stacey, but it was in your bio, so everybody's aware. But I think you have a desire to, at some point, have a Mi'kmaq Health and Safety Association.
Yes, I would love that. That is one of my future goals. And we're always looking for support, Corey.
Okay.
But that's the thing, that the goal is there, the desire is there. We just have to figure out how to make that happen, how to make that sustainable. But that would be an excellent place, much like any of the other. I mean, we have a fishing safety association, we have a home care association, but to have one Mi'kmaq led and to have those resources that are culturally appropriate, that have that understanding and awareness, it is certainly in my it's always in the back of my mind, figuring out how this is going to happen. So hopefully one day we'll figure that out.
Well, that was great, Stacey. Thank you so much.
Thanks for having me.
Appreciate it. So we're going to take another 15-minute break for a coffee and a stretch, and tune in 15 minutes.
We have a change in the agenda. Dr. Adams will now be presenting at 12:15, and now we are going to move Anne up to this time slot. I have the pleasure of introducing Anne Labillois. Anne is from Eel River Bar in New Brunswick and worked in her community as an addiction counselor for 12 years. Anne is a qualified instructor of mindfulness-based stress reduction and is currently studying philosophy at Dalhousie University, and has 3 wonderful children and 3 beautiful grandchildren. Welcome, Anne.
Okay. Can you hear me? Okay. Okay, wonderful. Oh, Welly Exikbu. I'm so honored to see everybody. There's some familiar faces I see in Eskasoni and Millbrook, and oh my goodness. I'm so honored, and thank you for inviting me to come and share my time with you. And it's always about sharing, isn't it? How we share each other. As I was listening to everything that's been going on this morning, it made me stop and think about the trees. I have this, I don't know, I just love trees. I love to go and hug a tree and stand there for about 10 minutes and then feel really good after I leave. Is that how the forest, I seen a documentary one time that just blew me away. And it was a woman that did a research on a huge area of different kind of trees that were just naturally there. And what she did is that she took all the soil away to see how the roots of the forest actually were, because she was studying that. And it was just profoundly amazing to see how, because it's all different, and there's all different trees there, and everybody's doing what they're supposed to be doing, but their roots were connected to each other all over the place. So this meant that when someone was having, she said, a hard time, like if there wasn't enough water getting somewhere, they could help each other. And that's how the forest is connected. And I said, oh my gosh, that's how we are connected too. We're connected like that, even though we've been placed on communities, and it's our, how we were created, our spirit, who we are as Aboriginal people. We have that root connection, that spiritual root connection. So, oh, I forgot to say, Welly Exikbug, Nindaluisin, Anne Labillois from Upigunchik. Again, I just had to share that with you. Sometimes when I find things like that, it just excites me because the world is such a beautiful place. You know, we see a lot of chaos and confusion and everything. And in all of it, I have to take my own responsibility, honestly. because I live in a modern world. I have a car. I have all this technology here all of a sudden. And Mother Earth and creation is trying to tell us something. I mean, it took creation to stop the world. Somehow it's trying to say something to us. We're not listening as well as we thought we were, or as I was. It's even brought me to my knees and saying, oh, okay, what's going on? What am I doing here? So yes, thank you. About mindfulness, when I came upon that, how it helped me in my life, because we talk about the ripple effect. Well, my mom and dad were Isaac and Rebecca Labillois from Upigunchik here. My auntie was Margaret Labillois, which a few people know. She was an elder that traveled around, and she believed, and her and my mom, they believed who they were, and why would they shy from being who they were? So, but my dad, at the time he was a young boy, he went into residential school. So when he came out 7 years later, which I never knew about until I was probably about 50 years old, nobody ever talked about it. He came out of there a very sick boy. So he came out with his lungs infected with TB. And as time went on, when I came around in 53, they found a spot on my lung, and they took me and they placed me in a children's sanatorium. I do believe it was in St. John, New Brunswick. And I was there for 4 years. So from 11 months old till I was 4 years old, that was it. That was how I grew up. My first introduction to everything. So I didn't know that was real. I didn't know that was real. I was having nightmares for a very long time. I was a very sick person. I would disappear from society. I would just, if I was around a crowd of people, I would literally get sick. And somebody was mentioning this morning about loneliness. Well, that's what I would feel in a crowd of people. It was like a wave of loneliness would just fall over me, and my stomach would get so sick I would disappear. I would go away from everybody. So I didn't know what that was. I deemed myself mentally retarded. I just thought something was wrong with me. So for years that went on, and I had nightmares and dreams of, seeing my parents and seeing this weird place or whatever. And when I was 50, I told my mom, I have to go see a psychiatrist because I can't do this no more. And she says, well, what in the world are you dreaming about? I said, well, I'm dreaming, it's always the same dream. I said, I see you and Dad walking out of this door, and I'm looking through these bar crib, and you're not turning around. You're not listening to me. I'm screaming. I'm dying here, and you didn't turn around. Why? And she said, she looked at me and she said, you remember that? And I'm 50 years old by this time, right? And I almost fell off my chair. I just looked at her and I said, you mean it's real? Like, this stuff is real? And she goes, well, yeah. She says, you were 11 months old when they took you from us and placed you in a sanatorium. Well, let me tell you, once I found that out, it was another journey, it was another doorway to find what happened to me or whatever. And I still don't really know. I have vague memories, and I kind of blacked out I remember that. I blacked out when they didn't turn around and come back through that door. I blacked out. That's the dramatic moment that I embedded in my very cell, every cell in my body. It stayed inside of me, and it's still there, but I've learned to meet it. And this is where the meditation of mindfulness came in. When I heard about it, I wondered how come I understand what they're talking about? How come I understand about sitting in silence? I didn't know. Like, how come I understand it? You ever know something and you don't know why you know about it? These things that come along. And so I ventured further, and I met this guy on TV as I was walking down the street one day, and there he was, and his name was John Kabat-Zinn. And he was the one that developed this mindfulness in the health center, in the health system in the United States through the University of Massachusetts. And it's there today. And so I made it a mission in my life to meet him. And so I did. Upon prayer and prayer, I finally got out to New York City with $50 in my pocket. And I lived off of that for 3 days, eating just pizza and salad. That's all I ate for breakfast, noon, and lunch. And I got to sit with him. And when I started telling my story, he says, you have to meet that little girl. You have to go sit with her. And just sit with silence, just sit with her. So I learned how to do that through the sitting. And then I started having other dreams of sitting with a group of people, except these people didn't have no bodies. They were like, but they had feathers in their hair, and they were sitting all in a circle. And I was sitting amongst them, and it was silent. And it was so beautiful. It was so wonderful. So I started having these dreams of this sitting in silence. And I said, oh my gosh, our people, that's what they did. Our ancestors, that's what they did. But I forgot how to do that. Because I say, oh, I don't have time. I've got to do this and I got to do that. And then we have all this worldly stuff that distracts us. And so now, today, I find joy in being able to sit with myself. I don't get to do it for hours on the day because life requires other things that, yeah, they do need to be tended to. But for some reason or other, it's more peaceful to walk through the chaos, to be the calm within the storm. We have that ability. We have that ability. I believe that with every breath I take, that we were born with that. But not to be afraid of it. Not to feel that, oh, and it's going to be hard. It's the hardest thing I ever did, and it's still the hardest thing to do today, is for me to be able to sit sometimes. I try to practice it when I'm jumping in my car. I stop for a moment. I take a breath, and I just feel myself, my physical body, and let everything else go. Because our thoughts are wild. We're always thinking and doing. And do you think that sitting in silence is not doing anything? It's probably the most important thing that we learn to do. Because in that moment, we are connected and knowing that we are aware that we are connected to all of creation. That was a beautiful prayer this morning of giving thanks to the stars and the moon and everything, because we're made up of all of that. Everything we eat is, nourished from the stars, and it has its cycle with the moon. And it's like, wow, it's so special. So it is challenging to try to share all of this within just an hour. Usually I like to take a couple of days to actually sit with everybody and have you really, really feel who you are. Because we're afraid of taking that moment. We're afraid of the thoughts that might come up, or the pain that, I ran away from pain for years. And I'm very honored to say, I'm a recovering alcoholic. And for me to be able to say that, I can tell my mom now, who is gone, I said, that's what it felt like. That's how you lived, isn't it? And that's how I talk to her, picture every day today still. To be able to sit and be well. To be able to be and experience all who I am. That means all of my pain, all of my worries, and to know that some of the thoughts that I have up here, which is the center of my world, and that's the center of your world, that not all of those thoughts are really mine. They've come from generations of whoever I met or whoever I saw react to something or what they believed. So it's quite a journey to find who you are and what makes you happy. She was talking about that today too. What makes you happy? I didn't know what made me happy. I really didn't. I know I didn't like the way I looked because I never knew I was Native. That's another journey that happened when I was 16. I didn't know. Nobody ever talked about it. We just went home every summer and, did what we did, but nobody ever talked about it. A friend of mine asked me, her father, he was a Jewish man, and he says, you've never told us what you are. Oh my God, nobody ever asked me a question like that at 16. What am I? What do you mean? I just knew I was from Canada, that's all. And he said, no, there's something more to it. So that was another journey. I asked my mom, what does that mean? Who am I? And she said, oh, we're Mi'kmaq people. I said, what's that? Like, if you don't know, you don't know. And that's okay. And I've met many people that didn't know that they had a wonderful essence inside of them. They didn't know that. They said, how could I have that? One of the places I enjoy going through when I was able to was in the prisons and sit with them. Would sit with our brothers and sisters and our children that are in there. Our people. And most of them would say, well, who are you? Who are you to say that I have a spirit? Who are you to say that I'm a blessed person? I said, because you, in your heart, you must have been thinking of there's got to be something else, and somehow you got me in here. Because here I am, and this is all I have to talk about with you. So, and it's been quite the journey, that's for sure. So I want to share with you we have about 20 minutes left. I'm going to ask you to sit with yourself. So if you can, And one thing about meditation, meditation isn't always sitting. It's an everyday life. Meditation is about learning how to be aware of who we are in everyday life. So that's running, walking, swimming, whatever we're doing. That's the real meditation, is to always be aware of who we really are and how we're really connected. So just make yourself comfortable, feet on the floor, if you can. To be, I say, to sit on like a majestic tree, like a majestic oak tree. We sit with our backs strong and straight, and we imagine, to help us to imagine that we have a feather on the back of our head, and that feather is pulling us up straight. So you'll actually feel it. You can pull yourself up straight. And if you're not able to, that's perfectly fine. You don't want to do anything that's going to, whatever state your physical being is in, that would produce pain. If there's pain, then adjust yourself until there is none. And I will mention that also about pain. So just close your eyes and just feel your breath that comes into you through your nostrils. That's where the life is blown into you. And as you breathe in, you'll feel your shoulders rise. Your whole body will move. And then let it go out and allow your shoulders and muscles to just go with it. So again, breathe in. Feel your chest and your shoulders rise. Allow it to go out and let it go. Take that breath in. Feel it and let it go out. Again, take that breath in. And as you're feeling your breath, this is what you do all the time. This breath in, this moment. This breath in, this moment. This breath in, this moment. Now when we take the next breath, we're going to say, we're going to all breathe together, which means your whole being. Let us celebrate with that breath. So our whole being, take a breath in and really feel your whole being. Feel that breath as it goes through every cell in your body and allow it to go. Relax your shoulders. Take another breath in, celebrate. Feel it go through right down to your toes. You might even feel tingling all over, and allow it to go. Release it. And when you release on the next breath, I'm going to ask you to just be as you are. Just be with your body, your physical being, and feel what it's feeling. Maybe your back is sore. Maybe your legs are cramped. Maybe you have a pain in your stomach, or in your head, or your ears, wherever your physical being is feeling, allow it to just be. So let's take that breath in. Breathe it, a nice big breath. Feel it and allow it to go. And just sit and be. And when we sit and be in this moment, we are touching all of creation. As our breath goes in, And it goes out, it touches the earth through our feet. It touches the minerals and the roots of all creation. And it goes up into the world, into the air that's part of creation. It touches the sun. It touches the trees, the moon, the stars, the water, the mountains. And then when you take your next breath in, it comes back to you. It's a complete cycle every moment. But it's to be able to take that moment and to listen to whatever arises. And when I say listen, you're going to hear your thoughts. Maybe some thoughts are like, I don't get it. I don't like this. I wonder what we're going to have for lunch. Or I wonder what we're going to do later. Those kind of thoughts. And when we hear those thoughts, we're already aware that we're not in the present moment. We're getting caught up in our thoughts. So if those thoughts do come by, no matter what they are, you can either see them as bubbles off the waters, and you can actually pop them and let them disperse. Myself, I like putting them in a white bag. And I put that bag full as much as I can when I realize I'm thinking about something or I'm playing a scenario over again. I can say to myself, I know what you are now. You're a worrying thought, and I don't need to do that right now. So I'm going to put you in this bag and I'm putting you up on this hook. And then this train comes by, this train that travels all the time in my head. I call it my train of thoughts. It goes by and it'll pick up those thoughts and I watch it go off. And then I say, okay, come back to this moment, Anne. Come back to this moment. Where everything I need is right here, right now, in this moment. Now just check in to see when you take the next breath and you bring it in. And when you release it, if you need to release your shoulders again. What happened? How come all of a sudden I need to release them again? This is what happens to our physical being every breath we take. Every thought that we think, we react to the thought. And our physical being reacts with it. And if we can let those thoughts of worry, pain, loneliness, anger, resentment, let them go. Let them go for this moment. Your physical being begins to heal. Your mind begins to heal. Your connection to creation begins to talk to you. And it doesn't talk in words, but it talks in other things. breath in and the breath out. And let your shoulders go. It's actually about waking up. Sometimes we fall asleep. That's because we're so exhausted in this world. So your breath is such a gift. That breath that we breathe. I know for myself, I've discovered I don't make myself breathe. Something far superior allows me to breathe. So we breathe with everything else. We breathe with the water, the pulsating of the oceans, the fish, the trees, the minerals. We breathe with everything because everything breathes this life energy. So bring yourself back now, can open up your eyes and move your feet. Just, kind of twirl them around a little bit. Your fingers, I always say, it's nice to move our fingers because we don't move them enough. And one thing I love before I jump right off the bed is that I do this exercise. I'll twirl my feet and I'll twirl my fingers and my wrists, because that, when you do that, it awakens everything inside of you, your physical body, everything, your muscles, your blood, the air inside of you. It begins to activate in a good, healthy way. And because we make motion like this, it moves our muscles and our bones and our joints and our wrists, and then I go for the big stretch. Stretch like a cat. Oh man, those cats look so great when they stretch. You never see a cat with arthritis much. So that's, my mom used to always say that. And so, yeah, there's, I would love to be able to share a couple of days with you, but this, I hope, when you sit with yourself, you meet yourself, honor yourself for that moment. When you take a breath, you just take that breath in and, yes, I am well. Most powerful words, I am well. When you are well, you will be at peace. I believe that. That's where I feel. When I say I am well, I'm not fine. I'm not okay. I am well. And so when I am well, I am at peace with my surroundings, with everything. It's a constant saying though, because we say all these other words, So I've trained myself and helped myself to say that I am well and to know that I am grounded. I try to ground myself when I'm driving. Don't close your eyes when you're driving, but you can say when you're driving, you take a breath in, feel your fingers on the wheel, push that breath down through your feet and know I am grounded. I am grounded as I'm driving. And it wakes you up for just that moment. So those moments are very special in our lives. And when we go for lunch, I'm going to ask you, when you take a bite of food, you're very aware that, try to be aware of not to swallow it right away. because I used to shovel. I was a shovel eater, emotional shovel eater. So I work at trying to chew my food and to really taste it and to see how I'm experiencing this food as I swallow it. How does my body experience it? Because it is. It's experiencing the food that we're feeding it. So I want to thank you for sitting with you. For you sitting with you, you're actually here doing this, and that is quite an honor for you. We're honoring who we are. We're connecting with our ancestors so that our minds can become well, so that when things happen, we know what the right thing to do is. We know what the right thing to do is. And it'll take practice. That's what our ancestors showed us, how to do that. Because they connected with the earth. They connected with all of creation. So, Wanse Wilaliam, thank you. And it's so nice to see everybody. When this came up, I ended up getting a call at the hospital, and they said that I was having surgery, which I had last week. That's why I'm on crutches. I said, "Oh no, I hope I'm not under those medications too long." So I worked at getting off of them, so I could be here. Thank you. Hello.
Thanks so much. Thanks so much, Anne, for your story, your words of wisdom, and your meditation activity. I think that it's really important, self-care, and we need to look after ourselves as caregivers, especially in 2020.
Absolutely.
Okay, so we've had a change to the agenda this morning. Unfortunately, Dr. Adams is not going to be able to join us. We're going to try to maybe, or possibly, maybe he will be able to join us tomorrow. We're hoping. So just as a overview for tomorrow, day 2, from 9 to 10, we have the mindful meditation with Anne again. So if anybody missed her mindful meditation, which is wonderful, this morning, then you can take part in that tomorrow morning. At 10 to 10:15, we have the stretch break. 10:15 to 11:15, maintaining mental health and wellness in the home with St. Elizabeth First Nations, Inuit and Métis Health. And then we're going to close at 11:15 to 11:30 tomorrow. Thank you, everyone, for attending day 1 of the Home and Community Care Conference. I hope it was useful. I hope you enjoyed it. Have a great evening, and hopefully we'll see you all tomorrow at 9 o'clock. Thanks again. Bye, everyone.